Okay, so this is about 2.5 hours after a lumbar fusion. You had a very degenerate disc, L5S1. We took the disc out and put screws and rods and a cage, and I'll show you the x-ray. How are you feeling?
Good, actually. Yeah, surprisingly.
Yeah.
A little bit tender and sore, but nothing like I thought.
And your posture, how are you feeling with that?
Feels good.
Good. Let's have a walk. So this is a day case operation, and you'll be going home shortly. And how do you feel? I mean, obviously slightly lightheaded, but
lightheaded, but I don't feel the walking. I thought was going to be sore, and it's not really. The main thing is when you lie on it and the pressure. That's the sorest part. But walking seems.
And you can kind of. How do you feel movement-wise? Just have a little. Seems alright.
Seems okay.
Good, stable.
Yeah.
Perfect. So this is the operation. It's an L5S1 fusion with screws, rods and a cage. And here you are, the day case. You'll be going home shortly. Fantastic. Good.